Just wanted to take a quick, so sorry, we weren't recording yet. I just wanted to welcome everybody to workshop number 1 on systems of the Justice Project implementation phase. I just want to take a second to introduce the planning team. It's the same planning team we had for the SAC process. So we've been together for a year now, or over a year now. And that's co-chairs from the IPRTF, or the Incarceration Prevention Reduction Task Force, Jack Hovenier and Stephen Gockley, Deputy Executive Tyler Schroeder, and myself. There's 4 of us. And then we have council staff that's supporting us from the council office, Kathy Hulk and Jill Nixon, and then our wonderful Crossroads Consulting that has been our partners. I've been working with them since 2018 in the listening tour. So they've been on this project from the very beginning. So without further ado, I'll turn it back over to Holly and she'll lead us through today. Holly?
Thanks, Barry. Welcome, everybody. Glad you're here. And for those of you who I haven't met yet, it's a pleasure. Some of you I had the opportunity to work with on the SAC process as well. So we're going to start today's meeting kind of with an overview of what we're doing here and how we got to this point. So I'm going to talk about the implementation planning process itself and what we hope to accomplish, how we're going to work through today's meeting. Then we're going to move into discussion, hopefully at 9:45, and work through the recommendations that are part of the systems component of the needs assessment. So next slide. And Kathy is doing my slides. Thank you, Kathy. So the foundation, the scope, and our process. Next slide. All right, so the Justice Project Needs Assessment, which if you haven't all had a chance to read, I highly recommend that you do. It'll really give you some context for this work, and it's a great report. It was built on previous analysis and ongoing efforts to prevent and reduce incarceration. It includes 16 needs, the highest priority system services and facilities gaps in the criminal legal system, and 32 recommendations came out of that. It's built, I also just want to mention that it's built on the Vera report, on the sequential intercept model, and that we had a lot of help from many people. So we had the whole of the SAC, which was 38 voting members, and we met 10 times over the course between January of 2022 and January of 2023. Just learned a ton, navigated a ton of really great discussions. And then we had the support of the IPRTF, the Behavioral Health Advisory Group, or team, which we call the BAGAT, and others. And then we also had a bunch of public input. A survey of 1,700 people responded, and listening sessions and so on. So we did a lot of engagement to get to this point, created the needs assessment. And from that needs assessment, then we came up with really priority needs and recommendations. And this work is going to be based on those needs and recommendations. Okay, next slide. So the report, when you look at it, is a combination of systems, services, and facilities. And they're represented here as a Venn diagram because they really are. These inextricably are linked together. They affect each other. So when we think about our work, we always want to bear that in mind, that these are all connected parts of the system, of the overall criminal legal system and what we're trying to do. Okay, next slide. This is another really important thing that came out of the work of the SAC, that, we have so many different perspectives that we're working with. And the SAC was a beautiful representation of that, with people working in the criminal legal system, people with lived experience of the criminal legal system, people who are providing services within a jail sitting, within the community at large. And with all of that input, we really came to unity on these core concepts, which to reduce crime and incarceration and improve public health and safety, we need to address the gaps in community-based behavioral health services. We need to be able to respond to lower level offenses through provision of incarceration prevention, diversion, and alternative services. And we need a jail that is safe for those who are in it, and the services to support successful community reentry, like as part of the design from the get-go. So even though we had a lot of variety on many issues, there's really a foundation of these core concepts of a balanced approach. Okay, next slide. So here's the scope of our work for creating the implementation plan. Some of you are going to end up because you were very nice people coming to every single workshop. Others of you may pop in for just some of the workshops. So you're brought here because you have some expertise to bear on these different parts of the needs assessment. And our goal here, the scope of the work, is to identify the specific actions and projects that are going to advance the recommendations in a 1 to 3 year time frame in general. And also we're going to focus in on what can we do in the next 6 months. So that's what we're hoping to achieve at the end. Next slide. All right, this is the scope, overall scope of, like, when you think about here, we've got the implementation plan. It's come out the other side. We have been enormously successful. This is what it will include. It will have the proposed systems and services, efforts and costs, the facilities concepts for community services and costs, like, not just a jail, but the other facilities as well. The jail facilities concept, including location and planning level costs, identification of the county departments, community leaders, and organizations to guide the implementation, and a funding approach, including elements in a proposed sales tax ballot measure. It was really hard when we were working with this act to not want to get into this level of detail, especially on funding, right? But we knew that we had to do this in the proper order. So we've got the needs assessment, the recommendations, and now it's our job to come up, fill in those details. All right, next slide. Now here comes the fun part. This is going to be like literally a fire hose. It's just going to be a lot of work, really intense and fast planning. So I'm glad you guys are in for the ride. Here we go. We've got all of you. We're going to do pretty much every week. So we've got systems, followed by services, followed by facilities. And we've broken it up into community services facilities, and then the jail and accessory services. And then last, this is not it's not in the needs assessment, but we need to talk about funding. So we'll do that on April 6th. So like I said, it's going to go fast. Towards the end, and actually we've already started the planning for this, we're also going to do some community engagement. So we have focus groups with priority audiences to be testing these things out, and a town hall scheduled for May 24th. Next slide. The other important thing, and this was true of the SAC meetings as well, is we just want to make sure we're keeping other, keeping other folks in the loop, in particular, the IPRTF, Law and Justice Council, and the County Council. So they're really we're in communication with them throughout this process. And next slide. All right, so that's the background. By the way, everything that we present today will always be up online. So if you have to pop in and out, or you forget what I just said, you can go to the online and review there's a video of this, right? And there will be notes, and there will be this PowerPoint so you can review. So these prep worksheets, as my colleague Marty Solomon and I started to try and figure out how we were going to make this implementation plan, we talked to the planning team and decided the best way to do this is to have these sort of these preparatory worksheets that you all would be adding into to start gathering the information and sharing ideas with each other. So a lot of you did that that will set the stage for today's workshop, and we need you to keep doing that, like more content. We expect that you will continue to generate content and add it into those worksheets, right? Because it really is all based, I mean, implementation is planning, it's just action planning. It's literally what you guys are going to do. So it has to line up with what you think is going to happen, or this thing is not going to work. So the worksheets are critically important. And we will be using the content from that today. Next slide. So going back, this is our schedule. I just want to remind you what it is. You should have gotten calendar invites.
I'm not hearing anything any longer.
Is this where Barry or Marty steps in for Holly?
Oh, it might, something
we
just died.
I was getting ready to, but then I
You're
saw her
back, Holly.
reappear,
Yeah.
so.
I'm back. But good, you guys just jump in. If there's a gap, you just jump in, cover it up. Okay, next slide, please. All right, here's another important thing to bear in mind. Like in our conversation today, we'll get as far as we get. We'll be using the worksheets. And then in between meetings, you all will also be doing outreach to find data, find information, talk to people, and then we scoop it up to the next meeting. We take the first half hour of the next meeting to follow up those threads, and then we go into the next major topic. So here we're in systems, we'll follow up and move into services. We'll take a little bit on services, move into facilities. And then once we get it so that it's pretty darn close, the content of any section, we'll survey for agreement, and we'll just keep repeating. So in concept, this is how the design will work. Next slide. All right. And I'm going to turn it over to my colleague, Marty Solomon, and we'll go back and forth here for a second to set us up with the discussion. Marty, it's all yours.
Hi, everybody. Nice to see you here today. So today we're talking about systems, and just want to define what we mean by systems, and that is the practices, policies, structures, and funding related to the functioning of the criminal legal system and the behavioral healthcare system. Next slide is, thank you, you're right on me, right ahead. So in the systems section of the needs assessment, there are 7 needs and 12 corresponding recommendations, which are all the highest priority systems changes that were identified in the needs assessment process. And the next slide shows what those needs and recommendations are. And I know you can't read this, but it just is a marker to let me remind you that you can find all of the needs and recommendations in the master worksheet that you've been sent and are hopefully filling in. And then also there was a PDF version that was sent to you for today's meeting. And the needs assessment report has all the needs and recommendations. I find that the chart that's very handy is in the executive summary of that report. And the report lives on the Justice Project website. So our goal for today is to discuss as many of these systems recommendations as we can. And next slide. Those of you who used the implementation planning worksheet know that it's set up so that you look at each recommendation independently, and then you fill in as much as you can about how to address that recommendation, what we're going to do for implementation. However, as Holly mentioned this, there's a great deal of overlap and interconnection between the needs and recommendations as you go through the chart. For example, many of the recommendations talk about data that is needed, and services and facilities are clearly related. So in our discussions, please feel free to point out overlaps between recommendations as you see them. To help us focus on today's conversation, I went through all the notes that you entered on the systems section of the worksheet, and I thought about how the ongoing and proposed actions you wrote about all fit together. So we're not going to go through all 12 recommendations individually today, but we're going to talk about them in 3 chunks. The first chunk addresses competency restoration, and that's a major system issue that relates to so many of the other needs that are identified in the needs assessment. The second chunk is about reducing the number of people held in jail pre-trial. And the third chunk is about data gathering and monitoring to track progress toward our intended outcomes. And I'm just gonna, I'll tell you where we are as we go through those. But first, I'm gonna pass it back to Holly for a minute to talk about how guidelines for participation.
Great. So here's a couple of things when we're in, we've got almost 2 hours to talk here. So here's some thoughts. First, just remember this is a workshop. We're all going to be making this up as we go. And we're here we don't have any formal presentation. This is all about a discussion among all of us to kind of figure out, how this is going to move forward. I would request that you raise hands to be recognized to speak. And if you all, hopefully you can all use the raise hand button. That makes it the easiest. In general, try and avoid repeating your own ideas or other people's ideas. We do track. And remember that time is fleeting. I think it's of course nice to hear stories about what happened in the past, but it's not going to be that helpful for us in this process. So we want to focus on what we need to do. We're going to get as far as we can and then work outside the meeting to get, take those next steps. You do want to flag relevant tasks. So as we're going through, if you're like, oh, we need to do this to get us so that at the end of this month, we have a report. So anytime that you go, oh, we need that, just mention it and we will track it. And again, as Marty mentioned, remember that these all are going to overlap. So you don't need to say this is overlapping because we know it is. We got that. It is definitely all of these overlap. So are there any questions before we move ahead? I'm also going to be taking notes using this Jamboard. If you've used that before, hopefully that's going to work, just kind of keeping us focused. If not, we'll shift gears. Okay. Anything? You guys ready? Okay. So Marty's going to, as she mentioned, there's 3 chunks or clusters of ideas. She's going to lay out what the main ideas are, and then we're going to move into discussion. So Marty, lay it on us.
All right. So the first chunk or cluster is about competency restoration. And in that, in A1, recommendation 1, which is about increasing access to inpatient competency restoration services, there were 2 short-term actions that stood out to address this need. One was to identify existing facilities with capacity for competency restoration beds to increase the beds for people to get treatment or get competency restoration services. Number 2, determine if a new regional inpatient facility is needed. So if it is needed, then there's this longer term action that would involve working with regional and statewide partners to get such a facility built. And I see Barry has his hand up. Barry, do you want to?
Yeah, I'm looking for all my buttons. Okay, I got my hand down too. So I think a great way to start this conversation out was maybe have just a short little briefing on the bill that's in the legislature regarding competency, and maybe Perry Mowry could give us just a 30-second, 1-minute status of what that is, where it is, and what we can expect.
All right.
Do you want to do that? Is that helpful, Marty, to do that right now at this juncture point, or wait till you do the kind of cluster? What do you think is going to be best?
Well, I just have one more part I was going to talk about, which is the outpatient. And I think that maybe that would be helpful to hear and then go into the bill and as part of our discussion. Perry, you okay with that?
I think it can change the landscape of the discussion. That's why I want to do it kind of up front.
Yep.
Yeah. Okay. So let's just, if you could go to the next slide, Kathy, which is about the increasing access to outpatient competency restoration services. The Competency Restoration Work Group is gathering information on possible formats for outpatient competency restoration, including the creatively named Outpatient Competency Restoration Program, and also prosecutorial diversion programs. The OCRP focuses on getting people competent to stand trial, mostly through medications and education about the court process they'll go through. And prosecutorial diversion programs are models that are more comprehensive behavioral health care treatment programs, and they may be offered as an alternative to jail as a diversion program. And an example of that is a model out of King County called Legal Intervention and Care Network, or LINC. And the next slide is the other short-term action that was mentioned in the chart related to outpatient competency restoration services. And that is to ensure that a new jail is designed with appropriate space to provide treatment to help people who've gone through competency restoration maintain competency until their case is settled, so they don't keep cycling between the hospital or an outpatient program and the jail. So then we could right now go into the background that Perry was talking about with the proposed bill. And then further discussion, which the questions are on the next slide.
Good. Okay, you guys got it. So there's interrelated things, all related to competency restoration. We can flip back to these slides at any point, but Barry, I think we're ready to, is it Perry who's going to give us a little background on the legislation, on the bill?
Happy to do that. I don't have super current information, but certainly of last week. If folks are unaware, Senate Bill 5440 was released by the governor's office, and the very short version, anybody please in the competency restoration group that thinks that I'm missing a component, jump in on this. But essentially is that the bill recommends essentially the process of inpatient competency restoration being put out to counties, as opposed to being provided through the state process, Western State Hospital, Eastern State Hospital, and some other locations, if you are aware. So that bill, just in terms of, let me pull something up here. Of the process that has gone through, it's obviously was introduced in late January. There was a Senate first meeting, and then it was referred to Law and Justice. I won't go through all of the processes, but most recently the Senate did pass it to the Rules Committee for a second reading. And the most recent information I have is the Senate placed it on a second reading by the Rules Committee. Some of this I'm taking some information, and I just want to own my own bias in terms of what I've been reading. The Washington State Association of Counties had some pretty significant concerns in regard to this bill, particularly relative to the fact that the state has been doing quite a bit of work through True Blood funding to address actually all aspects of competency restoration, but certainly aspects of inpatient competency restoration here, and have been marginally successful. I guess that's the way that I'll put it. There are many individuals that still wait for extended periods of time in jails in order to, usually it is not as much an issue of the evaluation for the need of competency restoration, but actually the services, the treatment itself in terms of inpatient competency restoration that has individuals waiting in jail for extended periods of time. So great concerns there, and as I said, a lack of success on the state's part in attempting to to put this process together and quickly address individuals that are in jail and are needing competency restoration. So Senate Bill 5440 essentially says this needs to, go out and be addressed on a county level. And where they make reference to, for example, in jail services, because if you'll understand, this competency restoration inpatient setting does need to be a secure setting, given the individuals that are involved in that process. And so obviously a location, pretty significant needs relative to that and relative to the capabilities of the location, as well as the professionals to actually provide that competency restoration services. So again, Washington State, WASAC, the Washington State Association of Counties, had great concerns about the fact that there were not any references to funding in relation to this. As well as just clarity in terms of some of the expectations that was occurring, coupled with the lack of success as far as the state's efforts in accomplishing this. So maybe I'll stop there. Maybe that's enough information at this point. Can certainly try and answer questions if folks have specific questions, or if I've missed a large part of it. There's a number of competency restoration work group folks here as well, so please.
Great. Thank you, Perry. So let's stay on the legislation for a moment and just make sure that people kind of understand at least what the implications are, even though it sounds like there's still a lot of unknowns. So Wendy and Michael and Barry speaking about the legislation, right? Okay, go ahead, Wendy, you're up.
There have been, as of Friday, around noontime, there have been some changes to the body of the legislation, which moved the desire to do inpatient competency restoration in jails from proscriptive, which is what it originally had been, which said that we would, to, well, you can if you want to. When I was on the conference with WASPIC, there's concern, it was with jail managers. A lot of concern with that, because a feeling is that it creates liability for those counties that don't have the resources, places, or whatever to be able to provide inpatient restoration treatment in their jail, because then the courts can turn around and say, well, this jail does, you don't, so therefore that's an issue for your county. There's also some language that seems to appear that DSHS is going to actually staff these units in the county jails, but I'm not real clear about that. And the last thing is that there is a concern that it's going to violate True Blood, because there had been an inpatient restoration treatment place over in Yakima as part of the county jail, and the federal court shut it down because they said that violated True Blood. So that's kind of what the updated information we got on Friday.
Great. Thanks, Wendy, for that update. Yeah, Michael?
Two questions. Someone please explain True Blood. I assume that was a court decision to me, and how that matters. And then, since this came as a governor's request, I mean, what is the impotence behind this? And the question is, how much momentum might there be for support that could come to the county if we indeed did set up a Whatcom County or Whatcom and Skagit or whatever facility? This appears to be there's many people looking at the same issue. So what is the momentum behind it?
Mm-hmm. And Michael, was your first question was to ask what True Blood was?
Right. How could you be in violation of True Blood? What does that mean? Please explain that.
Okay. Wendy, do you have an answer to those? Okay, go ahead.
True Blood was a case that was brought from Disabilities Rights Washington against the state of Washington because of the length of time it was taking to get original evaluations done and then inpatient restoration. Basically, the state lost. Federal government said that you as the state, because this is your responsibility, have to provide the evaluations within 14 days. And if someone it is decided that they are not competent, then they have to be placed in inpatient restoration facility within 7 days. That's never happened. At this point, I've got 25 people waiting, and they have told us it's probably going to be close to a year before we can get them from the jail down to Western State for restoration. Now, there is supposed to be that the decision also fines the state if they're not meeting those standards, and they're not. And there was also some demands to start expanding the ability to do restoration treatment. There is a new facility that's in the process of being built in Seattle right now, associated with the University of Washington, that will be 150 beds. I'm not sure when that's supposed to be coming online. I know the tentative construction cost is $253 million. So I'm assuming they've got some money for that somehow. But at this point, there are millions of dollars that are sitting in an escrow account that are fines against the state that the local judges all over the state of Washington have assigned. So basically, Trueblood said, you can't be leaving people in the jail untreated, unrestored, when it's your responsibility to be doing that.
So I think your answer to the first question answers my second one. That's where the momentum's coming from. Thank you.
Got it. Thanks, Wendy. That was great. Tyler, where you had the same, do you have?
I was just going to confirm Michael's point there at the end is that that's where the momentum come from. And it does seem like it's a local issue that we need to try to step up and help be a part of the solution. And it does seem like there's statewide momentum on the topic that if we try to figure out where to go, like there's a lot of opinions and good perspective on it in the worksheet. And we can really start to dive into those options and be cautiously optimistic that the state will help us to fund it and to adequately support it if the county, the cities, and maybe the region, the North region, step up with an idea.
Great. So with who's most closely from this group, or maybe outside this group, who's most closely involved in tracking that legislation and being involved in those conversations, Tyler?
I would point to Perry Mowry and the Competency Restoration Work Group, which is a local work group that's working through it and trying to stay up to date.
Great. And who here's on that work group besides Perry? Are there other folks? Okay, so we've got quite a few of you. Terrific. Anything you want to add at this point? All right. So Stephen and then Michael.
Just to add, I've seen some pushback about this idea of providing inpatient competency restoration in a jail setting. I can't remember if it's from the State Public Defenders Association. Maya Lisa may know, but there's, to me, a fairly obvious argument that that's a non-therapeutic kind of environment that may be less effective in the restoration service. I don't know if anybody else knows about that. I'm raising that more as a question than anything else.
Mm-hmm. Anyone have a thought on that? Yeah, Raylene? And then I'll pick you up, Michael.
I don't know if, we can get funding or we can get the right place, but it all comes back to, we don't have the staff to staff what we have now. So I think we have to come back and say, we can find a facility to treat people, but we have to be able to staff it. And I don't know where we're going to find these people to staff it. That's my concern about the mental health and the restoration is we have people that need competency restoration and evals for outpatient that aren't in custody. And a lot of those cases are just being dismissed because we can't, it's a year before we can even get somebody. And even then we're past a year on some of our cases, or new charges are being filed. And what I'm being told is that they have to go to the jail first to meet with the Trueblood requirements. And then they'll hit the other ones if they don't get booked on other charges, because there's not enough people out there. So how do we fix that first? You can build all the facilities, but you need the people.
That
Thanks.
seems really key. Let's hold that. So Michael and then Rebecca.
Well, first thought, I don't think you need to fix it first. If it's going to take you 2 to 3 years to build a facility and secure the funding, that gives you your deadline. That says you better start training people now. If you need those providers, you have a clock ticking to have providers in place. So I think actually they could go together well. But the point is well taken. You better be building the personnel the same time you're building the facility. You better be breaking ground on training the same time you're breaking ground on a facility. With regard to the point about in-jail setting may not be ideal, maybe one of the advantages of a county-based system is that we can create a parallel secure facility that may or may not be adjacent to the jail, but isn't actually labeled jail. That might be. And then my other question is, how many people a year are we talking about? Because that tells us how many beds or rooms we need. And Wendy, you had a number of people waiting, but can we get what size facility do we need? Are we talking about 30 beds or 3 beds?
That's a good question. Can anyone answer that? Yeah, Wendy?
Real quick, part of it is going to be that the orders are normally from 45 to 90 days. And so even if you took the 25 people that we've got right now and tomorrow there was a bed for them, they would then tie up that space. It's going to initially take probably 2 years to get rid of backlog if a facility all of a sudden showed up. I would say that they probably need to be looking at 25 to 50 beds. A little bit more if it's regional and brings in Skagit, maybe some North Snow, but definitely Island and San Juan. So
that's helpful.
Thank you, Wendy. Okay, Rebecca, you're up.
I just wanted to circle back to Stephen's original question. I can tell you that during my Law and Justice Day on February 7th, the prosecuting attorneys, I think their acronym is WAPA or whatever, the Washington Association of Prosecuting Attorneys, was also in agreement that the jail corrections environment is not therapeutic and therefore that should not be considered. And I believe WASPIC is of the same stance on that. So I can only speak for those groups because I heard it a few weeks ago.
Great. That seems like that's hooked to one of the questions we need to answer today, ideally, right? Marty, in terms of a direction to go? Yep. Okay. So let's hear from Raylene and then we'll focus back on seeing where we're at with that. Raylene, go ahead.
I agree that there's concerns with that being therapeutic of having it in the same setting, but a while back I mentioned that I would love to see the jail in the mall. Because sometimes having all of those facilities close by makes things easier. As we have a small court in Blaine, we do have the ability that when we get done, when a defendant is sentenced or convicted, they may have to go to probation, they may have to use bracelets, but the fact that we have probation here and we have friendship diversion to set up the jail all in one stop leads to less FTAs. If somebody needs to be restored, if somebody needs mental health therapy, if they need all of these other steps, having everything close together in one location makes it more beneficial and less chances for failure. So if you had a facility that was built that they didn't have to go far, that you could have, okay, the jail is on one section, it's on the east wing, and then on the west wing, we have mental health treatment and restoration. On the other wing, we have substance abuse. And then maybe we have low income housing, small dorm room apartments. I mean, this is just kind of my own little fantasy, but if you have the facilities that are close by and treatment, people aren't going to have to worry about the traveling to get places and they're more likely to succeed. So maybe all being in one section isn't therapeutic, but having it close enough that they're not going to fail is beneficial.
Yeah, thanks. Perry?
Just a quick clarification so that folks, that you understand, because we're beginning to mix some things. it really stood out for me that competency restoration is just that. It is restoration of competency for the individual to understand the charges against them and assist in their defense. It is not mental health. It is not behavioral health services oriented, as people are sort of familiar. Typically, it involves medication, antipsychotic medication, and education about the legal process, the charges, et cetera. So just wanted to make sure that folks were aware of that component.
Great, thanks for that. Yeah, Tyler?
I had one question for Perry about whether or not the North Sound BHASO needs assessment provided input on this question.
It's a great point, and I don't believe so, Tyler. I think that they were honestly looking at mental health services, inpatient and outpatient, but mental health services, and that would extend to evaluation and treatment, which is an involuntary facility. If you think about involuntary treatment admissions and that kind of thing, and also crisis stabilization facilities that are not involuntary, they're voluntary programs, and people are more familiar with that. But they did not look at the specifics of competency restoration and those needs related to it. So it's a great question.
That's great. I just wanted to confirm whether or not that was a resource or not to talk about the size. And then the other point I wanted to just bring up, Holly and Marty, is the spreadsheet has great next step recommendations on this inpatient competency restoration. I think a lot of our input probably from the group is already in that worksheet document, and I think we can just focus on that and identify some things to take the next steps associated with it.
Good. So let's pop up the slides then. And Marty, do you feel, I'm also taking notes on the Jamboard. Do you feel comfortable, since you're closest to the analysis, kind of helping us focus there? And I'll do the notes so you can do that.
Yeah.
Okay.
Michael, did you want to say something before we do this next step?
I did. Thank you, Perry, for reminding us that competency restoration is a narrow, specific kind of service. But is there a compatibility in the facility? Yeah, as I said, like if the West Wing is competency restoration, might it also be a secure facility for other behavioral health related services, which may or may not be court ordered or may just be offered because they're good? How compatible are those facilities and services?
Good question. Perry, do you have a response for that?
It's a great question that I don't have an answer to. So, yep, I honestly don't know about that, other than it's felt to me like the focus has been predominantly in that education and stabilization only.
So that might be something to, as a piece of research, to even find out if that's an option. Yeah. Yeah, David, you're up.
I'm just wondering if there's a middle ground when it comes to the competency restoration, looking at it at the county level versus the civil commitments and civil flips, because what we are getting from the department right now is information that those civil, basically when a felony is dismissed for to flip to a civil commitment, that those beds are being taken up that would typically be meant for restoration services. And it seems to me that it's a lot more likely that the county could step in on those civil commitments and provide services there than the actual restoration, which, as I don't remember who was Perry, I think it was Perry that mentioned that, you know, competency restoration is typically medication and education, which is done at the state level as of now. So it just seems like there might be a middle ground to adding capacity to the civil commitment beds that might alleviate some of the criminal restoration as well.
Yeah, thank you. Okay. I thought, yeah, Arlene.
I had a couple of questions. I just didn't realize until Perry said it that no mental health intervention is occurring in competency restoration. I assume that it would, because if a person is so in such psychological distress that they cannot understand the charges and what's going to happen, how would medication and education do this job? This is a little perplexing to me.
I think it's Miley. So do you have a response to that?
Well, Arlene, I know they do at Western State Hospital, our clients undergoing restoration do receive psychiatric medications and treatment in that sense, as well as the education component. So I mean, they're maybe not getting talk therapy, that kind of thing. They're usually just trying to use medications. Did you have, can you ask any other question you have about that? I could try to answer.
What did you say?
She just asked if there was if that made sense, or if you had a follow-up, or we could jump to Michael if you feel like that answered your question.
Not really, because if we decide on outpatient treatment, I'm just wondering how is that going to work for people who are under this particular psychological condition? It doesn't seem to me amenable to outpatient treatment at all. Logically, it doesn't make sense. I mean, if you've ever worked with someone who is in that state, I mean, Perry, can you explain this?
And one of the things that I'll just jump in super quick and say is that we were talking about inpatient comprehensive restoration, Western State, Eastern State, etc. at this point in time, when I was making reference to comprehensive restoration goal and intent. It's also true for outpatient settings, outpatient competency restoration program, very specific, that there is medication required by the court, as well as a very specific educational component to that. Not to be confused, and I know we're going to touch base on it, but I just want to offer this clarification that the prosecutorial diversion programs like LINK that Marty had made reference to, those are behavioral health oriented programs looking at social determinants of health, medication, behavioral health care, housing, etc. It's different programs. So I just didn't want to mix and create confusion. I agree with you, Arlene, at least from my background, but that I just wanted to be clear that the competency restoration, the pure aspect of competency restoration, as I understand it, has a very specific goal in mind, and it is not mental health stabilization in the way that we think about it from a therapeutic way. So I'll stop.
Great, that's helpful. Okay, somebody just had their hand up and then they put it down. Who's going to speak a second ago? Michael, there you are.
Sorry, I was having computer malfunctions there.
Yeah.
So if I could just add my little piece here, the education component, Arlene, is they have a whole curriculum on the forensic DSHS component website about all the education that's needed. It's pretty much flashcards and just kind of daily training about what the court process looks like. Like, does the client understand what a prosecuting attorney is? Where would they sit at the table? Do they understand what these charges are? And it's just sort of a redundant play out of what a court proceeding looks like as they're monitoring medication as well, hoping to get the person to I guess a therapeutic baseline to be able to understand what a court proceeding is. So it's just like the basics. And literally flashcards, like, do you know what this is? I mean, it's literally working at them from just like a base level.
Got it. Thanks, Michael. That was really helpful. Okay, so what I'd like to do is have us focus on the discussion questions that came from the original input to the worksheets and are certainly informed by the discussion we're having here. And Marty, do you want to just kind of help us focus here on how these, make sure we're all on the same page with these?
Yeah, I'll try. And Arlene, unless you have another question, why don't you put your hand down?
Okay.
At this point, so we don't get confused. So yeah, that's super interesting conversation so far. One thing I wanted to suggest is that we kind of, this is in response to a comment Michael made, that we be keeping an inventory of facility needs as we go through our workshops. We'll hit facilities on workshop 3 and 4. That's community and jail. And we can try and see how the facility needs fit together if we are just trying to track whenever facility needs come up.
Yep.
So I guess I just wanted to revisit the 4 ideas that I felt rose to the top in the worksheet so far, and see if there's agreement that these are directions to pursue, and then see what information we can get in the next month to try and build out the implementation plan further. And when I say a month, the reason, and Holly said this earlier, like the reason we are saying a month is because we have focus groups happening in April, the week of the 24th. And those groups are going to be looking at draft elements of the implementation plan. So we have to have at least drafts of some content ready to go at that point. So that's why we have this particular time frame we're looking at. We want to see how far can we get in this next month. Okay, so the 4 projects that I mentioned, 2 were about inpatient, 2 were about outpatient. The inpatient were to identify existing inpatient facilities with capacity for competency restoration bed. David Freeman said an interesting thing there about, can we get access to beds being used for civil flips? And correct me if I misunderstood anything about that. But there's an example, I believe, of what we would mean by that number 1 project there. Kathy, you could just stay on slide 26. That's okay. I'm going to go through them all. Thanks. And then the second one is to determine if a new regional inpatient facility is needed. The third is about outpatient. So that's exploring the feasibility of establishing the outpatient competency restoration program or prosecutorial diversion program. And as people pointed out, there's a big staffing question there. There's also facility capacity question there, but when we think about feasibility. And if it's the prosecutorial diversion program, then that of course has big implications for the courts and how that process works to divert people to services as opposed to a jail sentence. So then 4 is to ensure that a new jail design is designed with treatment space to help people maintain competency. And I just want to point out that's different from what we were talking about with the Senate bill. It's not to be a competency restoration facility. It is just to try to help people maintain so that they don't stop, decompensate while they're still waiting for their case and have to go back for competency restoration services again. Perry, want to clarify anything here?
No, I had a comment about number 1 when we get there, Marty.
Oh, we're there. Okay, wait. Wendy, did you want to clarify anything that I said?
I'll wait until after Perry's done. It was just.
Okay, so let's just dig into these and see if we have agreement that these are kind of the projects we're aiming for with the implementation plan. What do you think, Perry?
Well, I guess that one of the things that I wanted to say, and please, anybody else knowledgeable and certainly from the competency restoration group, chime in. But the information that we have relative to inpatient facilities in the state of Washington, there is no capacity. There isn't going to be capacity for an extended period of time. Although, you know, Wendy did, of course, make reference to the facility in Seattle that was being built. And so that, you know, could certainly have impact, and other things could have impacts as well. But I'd certainly be willing to, you know, take personal responsibility to get the data for, you know, identifying existing inpatient facilities, because I know, you know, from all the information that we're seeing and you know, the issues, that it's like, well, that's sort of a foregone conclusion. Correct me if I'm wrong. That's all I just wanted to put out there to save time.
Right. Is there anybody who sees it differently than Perry? Okay, so it sounds like really that has been, we know the answer to that question. Yeah. Great. Wendy?
One is that we'd need to keep in mind when you're looking at existing mental health-based facilities throughout the state, that they have to have the capacity to manage people who are very resistant and in really strong denial, which is one of the reasons that the state hospitals are pretty much reinforced physically and have a lot of security personnel. The other comment I wanted to make is that one of the things that can happen is if you have the treatment space inside a corrections facility, you can actually move towards restoration without having to go through that whole process. If we have the staffing and the individuals who are trained in how to deal with folks who are really mentally ill, can lead them, persuade them to take medications versus forcing it, get them involved in group therapy, one-on-one therapy. And even now we see some folks who initially appear that they need to go to restoration, but they've become trusting with the mental health professionals we have, will start engaging in behavioral modification and some therapy that we can provide here. And then it comes to a point where they probably don't need to go to the state hospital. Doesn't happen a whole lot because we just don't have much space, but that certainly is a good possibility when the time comes to design a new jail, that we have those kind of therapeutic units, because we may be able to get rid of the need to send somebody to state hospital for involuntary restoration, and or at the very least, if they've been restored, continue that and build on it while they're here.
Great. Thank you for those clarifications. Yeah, Caleb?
First, did Michael have a clarification or question about what Chief was saying, or?
Michael, did you have something you wanted to clarify right now?
Me, well, I just kind of wanted to piggyback off Wendy just said, if that's appropriate right now.
Yeah, so go ahead, and if you can weave it into what's the agreement, the project list, that'll help. Like
Sure.
just to clarify, make them stronger.
Yeah, no, I think a hybrid model is what I'm hearing from Wendy. You know, utilizing a team of individuals who understand the competency education component and can actually go into the jails that are currently in existence now and start the physical therapeutic work of educating the individuals towards competency while building or looking to establish a new facility. Is kind of what I was thinking she was saying.
Got it. Thank you. Caleb, and then my Lisa.
So I was also intending to piggyback, especially for highlighting number 4. I think it's important to recognize that thematically, the facility itself needs to not negatively contribute to people's mental illness in such a way that it's designed to, you know, intentionally, regardless of where people are housed, not have negative impacts on their mental health. And so I'm not saying that number 4 is wrong. I would say, though, that let's expand that concept to all housing so that it's not, you know, intentionally or overtly contributing negatively to people's mental health.
Good point.
Thanks
Great.
for that, Caleb. I really appreciate those comments. And I wanted to circle back to Judge Freeman's suggestion of creating more civil beds. And I mean, I think that is needed. My concern is that if we were the county to create civil beds, and we're the only county doing that, we are not going to get any priority for our competency restorations just because we're now accepting civil flips and providing services for those folks. I don't think it's a bad thing to do, but I don't think that it's going to result in solving the competency restoration problem. Just that's my thought on it.
Thanks.
Could you just clarify that a little bit more? Like, so we take in people for civil, I need a little bit more information of what happens to those competency restoration beds if we're taking.
Well, they would be open statewide. So, you know, like they could get filled with people from King County or anywhere. Like it wouldn't necessarily be Whatcom County folks that would then go into those slots that we were relieving.
I see what you're saying. Thank you.
Yeah, David?
Yeah, I have to be a little careful on how I comment here, but going off of what Maya just said, my intent with my comment was if we're looking at the state level and state changes fundamentally to shift competency restoration to a local level. Right now, what I'm hearing from Perry and others is that might not be an attainable goal because of a number of factors, including the federal litigation under True Blood. My comment was more at the state level, looking at could the civil commits be shifted, that burden be shifted more towards the county level, not just Whatcom County, but elsewhere as well, because what we're getting right now from the department is that those civil commitments are taking up bed spaces that were dedicated to criminal restoration previously. And so again, I think it would have to be done at a state level. I agree with Maya, but it might be a more attainable goal than shifting everything to a local model of restoration.
Those are really long commitments sometimes, I think, is what we need to be cognizant of. You know, we're talking about, whereas competency restoration, you don't, it's 45 or 90 and then additional 90 and then potentially and very unusually another 6 months. But I mean, so we're looking at like a year really, but these civil commitments can be very, very long. So that's it's a different character.
Thanks. Good discussion. Okay, any other discussion on these 4 projects? And we've heard some shake off the list and some variations on the theme. Perry?
Out of respect, I think that Michael was first. if I
Oh,
can't-
Michael, you know what, Michael? Your little hand is like the same color as I think some of your art on your wall. So anyway, sorry, go ahead.
No, that's okay. To talk about number 3 here, I did find that there was, I did a lot of fishing yesterday and found out that there is an outpatient competency restoration program down in Pierce County through Greater Lakes Mental Health. And they have a FACT team, kind of like PACT, but for forensic folks. So they're doing some work down there. I tried to reach the forensic department program administration yesterday, and I haven't heard a call back, but I heard that there's a couple more outpatient programs as well.
That's excellent. And it really segues us to the core question, which we need to be focusing on here, which is, okay, what more information do we need and who's going to get it? So it sounds like, if I'm hearing you right, you might be willing to keep on seeing if you can find out more about the OCPR. Yes.
And I'm sorry, that's a typo. It should be OCRP.
As I said it out loud, I was like, something's not right.
Got the letters in the wrong order, sorry.
But Michael, is that true? Are you willing to keep on dogging that?
Yes,
Great.
that's fine.
Okay, super. Yeah, Perry?
So a couple of things, Michael, I did an interview with an OCRP program in Clark County, so you can make a note to give me a call. I can have that discussion with you as well. That one also funded through True Blood, Healthcare Authority, et cetera. I had, just touched base on an initial thought as far as project number 1 and probably it not truly being a project. But I am very much in agreement of a discussion around a regional inpatient facility need relative to competency restoration. offset of costs, all the other things as well. And in regard to number 3, when I stated earlier, just relative to what the goal of OCRP programs are in comparison to at least my understanding of what the goal of prosecutorial diversion programs are, I lean towards those. I mean, I'm sure there's different varieties of prosecutorial diversion programs, of whether it's contingent on, the charge being dropped and, and et cetera. But I tend to lean that way, but then I'm biased as a behavioral health, professional, that makes a lot of sense to get that stabilization through, connecting to resources and et cetera. And I really appreciated also what Caleb was saying, because the only piece that I'm a little uncomfortable with in terms of project number 4 is, in terms of ensuring that the jail is designed with treatment space. I wasn't thinking, when we were talking about this before, and certainly more recently, that I wasn't thinking of it being specifically relative to competency restoration or competency cases. And I think that where Caleb was going was in a more general way, the mental health of individuals that are involved in the jail, because we have a number of individuals that have significant mental illness that are not competency restoration, involved in, et cetera. So I guess I just wanted to say that in terms of a clarification. I wanted to say that in terms of a clarification. Thank you.
Right. Thank you. And I think that a couple things there is who is going, if we're talking about determining if a new regional inpatient facility is needed, like who would be kind of leading that effort? Who would be starting that conversation to determine that? Does anyone have a thought on that?
I can certainly take this to the North Sound BHASO. I mean, it makes sense that would be a convening of that, not necessarily, their responsibility per se. And we're fortunate in that Councilman Buchanan is the associate chair of the board of directors with the ASO. And so I'm certainly willing to take that step, just as far as engaging and getting thoughts from the BHASO relative to a feasibility study or a need study, in regard to that.
That'd be great. Okay, and Barry, does that make sense to you as well? Sort of start the conversation there.
I certainly, yeah. I have actually a meeting with them at 12:30 today.
That's what we're looking for. For action. Here we go. Okay, Scott, you're up.
All right, this is a procedural thing. So I've been in this for too long in my mind, but all right. But people use like OCRP, PDP. Now I just heard BHASO. I heard ASO. At least in the outline, can we have what these things mean before we use them? And because a lot of us are probably like me, not so clear in all your vernacular of all these acronyms, so that it at least introduce them so that we know what they are before we use them. That would help me try to understand what's going on.
Thank you for that. I was doing the same thing, like writing as fast as I could. So let's do that as we'll all try. Yes, it is when we're using acronyms to say them out loud at least once, and then we'll keep a running list of a little cheat sheet for us. Do you want to say what those are? ASO and BAHSO, Perry, while we're here?
You absolutely, and my apologies. Behavioral Health Administrative Services Organization is located in Skagit County, happens to be located in Skagit County. I think that the definition of it is it's a quasi-governmental entity that does a number of different things. But one of the important things for my role in it is that they receive money from the state for the 5 counties, Whatcom, San Juan, Island, Skagit, and Snohomish, North Sound region, and they are predominantly oriented towards crisis services and funding for crisis services that comes from the state. So they have subcontracts and they dole out dollars relative to those services and some others, but I won't go into all that detail. So Behavioral Health Administrative Services Organization. OCRP, not to be confused with OCPR, is an outpatient competency restoration program. That is, as Michael Smith had defined, it is really a program that was created by the state healthcare authority. If I make my guess, they are outpatient programs that have the specific purpose of restoring competency for individuals that have been charged with crimes that allow the individual to be released into the community, persons out of custody. And so they typically work with medication and also a very specific educational program to have the individual understand the charges against them and to assist in their defense. That is really the start and the end of what outpatient competency restoration programs, OCRP, are. Another model that has been used is prosecutorial diversion programs, PDPs, that are essentially programs that support an individual who the prosecutor's office has determined that they are going to drop the charges on, typically low-level charges, not low-level nonviolent charges, for individuals that have serious mental illness. Those programs assist the individual oftentimes in medication and in mental health services, as well as housing, if that's available. The LINK program, Legal Intervention and Network of Care in King County, does this. And so they essentially work with the individual's needs to divert them from re-involving themselves in the legal process. And so that's the difference between prosecutorial diversion program and an OCRP program.
So
Hopefully
yeah, that was really well articulated. So here's a question for you all. Do you think that in the implementation plan that it would be valuable to pick one or the other to focus on and to advance? Yeah, Stephen?
I'll just start with a point of clarification that Perry might help me with. Most of us have seen the communication from Dr. Thomas Kinlan at DSHS describing the outpatient competency restoration programs, the components of it in the 11 counties that True Blood implementation has ostensibly rolled out in. The array of those programs, which include an immense and deep pool of wraparound services, including housing and some other support services, look very much like what we've described or had described to us as prosecutorial diversion programs. So what I see there is the difference between the two is OCRPs restore competency and then plop person back in the criminal prosecution process. So we still have a case going in the system, whereas the prosecutorial diversion program has shunted them almost entirely into a social service network that supports and diverts somebody from the prosecution track. So if that's the case, then a PDP obviously has benefits because it reduces the number of people flowing through the criminal legal system. And if the services are essentially the same, that seems to be a big advantage to me. Now, I'm not sure if my premise there is right. Perry or Maya may know more. Michael may know more.
And my question is, I want to go back to the question though, is do we want to really focus, what would we need to know to be able to focus our energy for this implementation plan?
Well, that's why I raised my hand there, Holly, because I would say if my premises are right and there is that difference and a logical benefit to a PDP, that we might want to specify that as a target goal.
Mhm. Great. So Wendy and Perry and Michael. Go ahead.
I think that we're going to have to keep both, because there are going to be some offenses that would be more appropriate for restoration under the OCRP. Even if they're low-level crimes of violence, domestic violence, that type of thing, I think you're going to find a lot of reluctance on the part of a prosecutor to move them over into a diversion program, because they want them restored, and then there may be additional treatment or whatever, counseling, batterer, that kind of thing, because those are generally offenses of personal violence. The prosecuted diversion program, it's like a ramped up version of what we used to do back in the day, when we would have somebody come in, they had thrown a huge rock through a window. That's actually a low-level felony, depending on the size of the window. But we'd approach the prosecutor and say, look, this person is very ill, very schizophrenic. We can get them detained, but I need to get them out of custody in order to do that. And about 9 times out of 10, the prosecutors would just not file the charges or ask that the charges be dismissed for the cause of justice. So that gets them completely out of the criminal justice system into the civil mental health system. And I think there's room for both of them, because if nobody's been hurt or that's going to be a sticking point for a lot of prosecutors. So it may be something to consider.
So I'm just looking at the clock. And so for Perry and Michael, if you have a different opinion than that, I think we could, in other words, we'll still hold both, then speak. Otherwise, we should probably move on. Michael? You're good.
Yeah, I was just gonna say, we sort of already have a hybrid model of a prosecutory diversion system with mental health court and lead. Comprehensively looking at them together, that's ultimately kind of what they already do. So,
Okay.
Yeah.
That's helpful. Okay, so Marty, anything else that we want to talk about here before we move on to the next cluster?
I think I just was curious if the competency restoration work group might be able to take a few next steps on these and try and help refine what it is we're putting in the implementation plan with a little more detail, and we bring that back next week. Is that possible, Perry?
That was actually part of my comment, that my hesitancy is that this is, I think, the direction and the investigation that the competency restoration work group is doing. I didn't want to make an assumption on the part of that group that we would be pursuing one or the other, because that hasn't been determined by those very knowledgeable and folks. So I think that is where we're going. And we have another meeting on the 17th next week. I don't know that we'll come to a conclusion by that point, and of course I can't speak on behalf of the competency work group, but I think that this is helpful, as a component of that as well. And I'll stop.
Good.
So the 17th is actually the date of our next workshop.
That's a busy day.
Right. Yep.
Yeah. Okay. So whatever we can do to refine the direction we're heading between this meeting and next, great. And again, this is an ongoing rolling process over the next 4 or 5 weeks. So we just are going to have to keep evolving our actions that we're for addressing the recommendations. Barry, were you going to say something else on this?
I was, but I was just agreeing with Perry. I think we should be taking this up in the work group. I think it's these are all great questions that we should be talking about. So that's it.
Wonderful. Well, let's move on to the next section here. So this is going to be chunk 2. Chunk 2 is about It's the need A3, and I'm going to focus on recommendation 1. It's about providing a range of pretrial release and monitoring options in lieu of bail. And you can see there's kind of 2 parts to this. There's the expand the use of pretrial diversion programs, and there's the reduce the use of bail. And so let's look at each of these separately. The question there, in the worksheet, when we talked about, almost everybody who filled out the worksheet talked about the pretrial diversion program efforts, and electronic home monitoring was mentioned, but there wasn't anything about next steps to take to implement the recommendation. So I was hoping that we could start by talking about that and then move on to talk about reducing use of bail. So does anybody have any comments on this, actions to take to make progress on expanding the use of pretrial diversion programs?
Caleb, did you have a thought? I thought I heard you. Okay.
I put my hand up, but
I saw that.
didn't get the virtual hand up, but Raylene, go ahead. Me, you were faster.
I just wanted to mention that, we started the diversion. Some of it was pre-COVID, and then more after COVID, and with jail restrictions, the diversion programs have been expanded. There are certain laws that prohibit us from putting somebody on electronic home detention. Some charges, it's not going to work for everybody. There's certain people that you can't put on bracelets. There's certain people that are just going to cut them off. There was one recently of a gentleman that had several DUIs, and he was released, and he was put on a bracelet, and he cut it off, and he died that day in another county. So diversion programs are great, and they do work, and they help for a lot of low-level offenses. And I think we want to keep people on diversions that qualify for those. It allows them to continue working and contributing to the society, and we want to try to make them better, as well as with some of the new DV laws that are being pushed through currently. I don't know if they're going to make it through, but on protecting victims. So I think we have to be cautious moving forward if we're looking at diversion programs with bracelets. And remember, not everybody is going to qualify or be a candidate for bracelets. And there's also a concern about liability, and we can't leave that out when we're reviewing this.
Absolutely. Thank you. So the question here is, appreciate those insights, and what information can we get to help make this part of the implementation plan so we know what to do next? Caleb?
So I think that the information that is necessary are over declarations of the legal parameters for each of the pretrial programs, such as monitoring and detention programs. There are obvious rules that we can't avoid, and there's obviously some of the advice that we've been given, legal advice that we've been given, not to do specific programs for specific participants for the reasons that Raylene just mentioned. So I think we would need to get a specific list of those rules or things to watch out for in order to make sure that that's clear. As I mentioned in my comments on this section, there's a lot of this already going on with district court probation. So district court probation can potentially incorporate more, pretrial diversion, but this all has to be carefully, done so that we're not stepping on legal toes, so to speak.
And is that another piece of information we need, is to know what those edges are?
Yeah, that's what I'm saying, is all of these edges need to be defined. Like, is it against RCW to have these particular offenses on a monitoring program? What are the things that our prosecuting attorney's office is saying we should not do, and what to avoid in that regard? And so those are the pieces of information I think is important to understand before we move forward, because simply saying, let's just expand it doesn't mean that it's possible.
Right. Great. So I'll call on other folks, and then my question, of course, is who can do that research? So go ahead, Maya.
Hi. Well, I think that the civil prosecutors would want to weigh in on liability for that kind of thing. And I think the name we're using is wrong. Pretrial diversion programs. I think what we're talking about is pretrial services programs, which is there is a branch of it that exists and in the Superior Court where in addition to, or as instead of requiring a money bail, the court will require pretrial services, which is periodic check-ins kind of, and there's a low, medium, or high level of services. Diversion suggests that like the case isn't going to be prosecuted or something, and that's not at all what's happening. So I think, I don't know if people are getting confused on that. So I'm on the pretrial services group, and the things that we're struggling with right now are, what does the data we've collected so far demonstrate? Is it race neutral or not? And we are really struggling with those numbers, trying to figure out whether the risk assessment that's being employed is fair and if we should continue using it or not. And we've talked about how pretrial services is linking people with the LEAD program and trying to help, also steer people towards services for stability so that they're able to show up and make their court appearances. Those are the sorts of things we're talking about in the pretrial services work group. Thanks.
Great. And it sounds like I didn't know about the pretrial work group. So that sounds like another body maybe where we could gather information.
Part of the Incarceration Prevention Reduction Task Force.
Oh, right.
Judge Garrett is the chair of that, and Judge Freeman appears, and other people here come.
Good. Okay. Yeah, go ahead, Wendy.
We can easily pull out if it would help people come to some conclusions. I can run a report that will tell us how every person for a specific period of time got out of jail. I did one just for February, and out of all the people that got out of jail, 63 of them bailed out, 79 of them were released, and then it goes down from there. But we could do that for all of 2022. I suspect I can also reach out to the IT guy that we've got, because Maya mentioned whether it's related to race or ethnicity. He may be able to cross-check that data, which is a report that we can get anytime, by race. And that Rick is really good. We could probably get something to the group if they felt it would be useful fairly quickly, like within a few days, if that would be helpful.
Yeah, I think that would be great.
Okay. I'll talk to Rick as soon as we're done here today. I can just run the regular numbers so that you'll have an idea of how it is that people get out of jail.
Wonderful. Thank you. Yeah, Michael?
Well, Wendy's my new best friend because she seems to have the answers I want. I want some numbers. It's the same question as before. How many people are not being given the chance for pretrial release and monitoring and pretrial services? What is the size of the need? So Wendy can tell us how many are currently getting it, but how do we figure out if the idea is we should do this more often and whenever possible, well, how many times are we not doing it when it might be possible and appropriate?
Mm-hmm.
We may be able to parse that out. I'm sorry, I interrupted. We may be able to parse that out by looking at length of stay for certain categories of folks. I mean, right now I've got 22 people, who've been in jail for longer than a year. So clearly they haven't been able to get out. And we can do it. The report has it blocked out in groups. And so I can probably get what the length of stay is, or the number of people who fit within those categories. Let me play with it, and if it's okay, I'll send you a copy of the spreadsheet, you can take a look and see if it's getting you what you're looking for. How does that sound? Okay.
Yeah, I'm thinking that that might be a good thing. I don't know, to hyperlink or something, but yeah, if you'd send it to Marty or send it to Kathy as well, if you would, please. That would be good. Okay, with the list of rules and talking to involving the civil prosecutors in that, so we kind of know what the options are. Is somebody going to take that on or able to take that on? It was a good suggestion. I'm just wondering who's the most likely candidate to find that out and have that conversation. Yeah, Caleb?
I think it's probably going to come down to me, you know, if nothing else, because I said it, but I don't have final authority on everything. Like Maya said, it's going to come down to what the civil prosecutors have to say. It's going to come down to RCW. There are a number of things that need to be thought of. So it probably will come down to me.
Thank you for doing that. And this is not to like dissuade anyone from having an idea that you'll then be forced to do it. But if thank you, Caleb. That was great. And, like you say, all we're trying to do with that is just gather information so that we really have a sense of what the options are and where we can make a difference. Okay, anything else on this one, Darlene? Yeah.
I'm sorry, having a bit of a computer issue. I was just going to mention, though this doesn't relate to the size of the jail necessarily, I know that district court has started a family treatment court. I know that Bellingham Municipal is in talks, the very initial phases of a community court. And some of these courts are possibly going to be diversionary, not just pretrial services. And so they would hopefully divert people from going into the system. So I just wanted to put it out there that courts are looking at ways to do more of that. And that's an exciting thing to see in our community and may be helpful in this area.
Yeah, it sounds like it. To bring that forward as part of the context of what's going on. Yeah, Maya?
It just family justice court is not diversionary, and a community court can be. That's true, and maybe that will be true in municipal. I don't think folks that are eligible for community court would likely be incarcerated, though, based on my experience looking at it in Skagit.
Maya, why does it not count as diversionary?
Well, family justice court, you can only enter family justice court if you're convicted and sentenced of something. So there's no diversion. You are in fact completely in the criminal legal system.
I can see your wheels turning, Michael. Do you have a follow-up? Okay. All right. Raylene.
I just want to follow up with a question for Maya.
Mm-hmm.
I agree that it's not a diversion in essence, because they're still in the criminal justice system, but isn't it true that there's some of the felony charges that are being diverted down to misdemeanors if they're willing to participate in?
So, I mean, there are plea negotiations that take place where sometimes, there's all different ways that global and plea agreements take place. Sometimes charges are reduced to misdemeanors to get into family justice court.16Sometimes they plead to a misdemeanor and then a felony is held over their head in order to enter into family justice court. The only way there is no family justice court that applies to felonies. So necessarily the person has to plead to some kind of misdemeanor to get it, but that doesn't mean that the felony goes away. It can be, I really want to reserve the term diversion for folks that their charges are taken out, their cases removed from the criminal legal system, like Link, this competency diversion, prosecutors are dismissing, and those people are getting diverted out of the criminal legal system into a mental health care program. We don't have a lot of diversion programs in Whatcom County.
Okay, is that definition? I really appreciate you offering that clarification. Is that something that we need? I mean, we're not going to debate it today, but is there anyone who's like, I'm not sure that's what we're really talking about with that term? Yeah, Caleb?
I'm not saying she's wrong, but I wanted to question, and I'm just throwing this out there. When I think of diversion, I'm thinking usually jail diversion. And so, at least in the context of what we're talking about here, pretrial diversion means somebody who doesn't have to spend their time in jail while they're pending pretrial. And I know that that's a bigger question, but
That's
like,
why this name doesn't make sense, because we even call it we call it pretrial services. It's
Okay.
like, I don't know why it's getting used. I don't
I
know
think that
of
that
anywhere
was,
else that this term is used this way.
I will, we'll change that. That was not a good choice.
So
Okay. Okay, so that we don't need to belabor the point, but we will make sure we're using consistent terminology on this stuff. So we have clarity in our work and in the report. Okay, gang, we're going to need to, yeah, Darlene, go ahead. And then I think we should probably jump to the next one.
I was just going to say that I think there is a distinction. I think what Maya is saying about diverting people from the criminal justice system, but there's also diverting people from jail. And some of the programs that we are using are keeping people out of jail because they're in those programs. And maybe there's a way to better define that. For instance, mental health court that both the city and the county have, their charges are dismissed if they go through the program. And so those charges are gone. In some of the things that we're talking about, it's just keeping them out of jail. And so maybe there's a better way to define those.
Maya?
Sorry, but those who participate in mental health court or any of those courts for the whole 2 years or however long they're in the program, they are subject to going to jail, because if they violate, or, you know, like in recovery court, there are certain sanctions that involve people going back into the jail. So they are sentencing alternatives, and I get it.
Maya, should we call them alternatives? If we adopted a consistent usage, those are alternatives. No, I think it's important to not confuse ourselves by saying the same word for 2 weeks.
I mean, now I agree, like recovery court and mental health court at the end of a 2-year participation program will remove conviction, or, you know, avoid a conviction in the case. But it's a lengthy period of time that they are subject to potential incarceration and occasionally are incarcerated. I don't know the answer to your question, Michael.
Okay, so what we know is that one of the pieces that we're going to have to get clear on is how we're using these terms, and that we're using consistently, which will really help with our work. Okay, we need to keep going. Yep. So let's take the next piece. Kathy, if you could flip the slide. And I don't know about the rest of you if this is helpful, but you know, there's a toggle in your screen. So like for right now, I've got mine toggled to the left so I can see the screen and I can see all of you. So if you're not doing that right now, it makes for a more interesting experience. Let me just offer that, rather than seeing the screen and then just this little line of people, you can toggle over. Okay, so we're on to our next question. Marty, go ahead and set us up, please.
Well, this is just the other part of that A3 recommendation 1, which is about reducing the use of bail. So diversion services it says in lieu of bail. So with reducing the use of bail, one idea was suggested on the worksheet that was conducting a review of bail amounts, like what are they, how are they set? And there were not any other actions listed regarding reducing the use of bail. So that's the question for you all. What actions can we take, and should we conduct a review of bail amounts?
Anybody who hasn't spoken yet, maybe, who would like to jump in? So what do you guys think? Should we conduct a review of bail amounts? Would that be helpful? And what else would we need to do to reduce the use of bail? Heather?
personally think that that would be helpful, just to have a great starting point of what levels of bail are set typically for what kinds of charges, and is it consistent across the board, and where it isn't, why not? And I think there's a feeling often in the community, or a perception of bail is a system that really penalizes those who are in poverty, and that if I'm wealthy and I commit a crime, I can just pay my bail. And I also understand it's quite, it's a really important tool for safety. And then there's the court rule 3.2 in there too, of, presumed innocence. And so I do think this is a really important, particularly when the jail is 90% plus pre-trial. Really, this is a key piece of the puzzle. And I think it could be a great starting place for understanding prosecutorial decisions about their recommendations, and judges' decisions about the bail at the end of the day, and the public defenders for that matter, of, where is there opportunity to standardize or do better as a system.
Thank you. Great, Raylene, and then Michael.
I think if you're going to do a review of bail, you have two different areas to look at. One is, are they setting bail for an individual that's already incarcerated? Two, are they setting bail because the individual hasn't shown up for court and there's multiple warrants, and so you're issuing a new warrant to set bail? And then when we're looking at it, if we're going to review bail right now, I don't know that you would get an accurate description if you're only reviewing bail of the individuals that are currently in custody or incarcerated, because a lot of those individuals are waiting mental health issues, are extremely serious felonies that are being held. You're not seeing misdemeanors being booked unless there's usually a companion felony charge, or it's a statutory mandate that an individual is booked into custody. And even with the statutory mandates on gross misdemeanors, it's domestic violence and DUIs. And currently in Whatcom County, the DUIs are turning around and being released as soon as they're sober enough, and they're not being held in jail as they're required to be by law. So I think you're going to get a very skewed study if you do that right now. Thank you.
Thank you. Michael?
Yeah, I was going to say, I haven't really looked at the bail system in quite a while. But I do think we need to look at it, especially from a cultural standpoint. A lot of individuals just kind of plead to charges and kind of clog up the system just because they can't afford the bail, and they've sat in jail for quite some time. And there's just a whole dynamic of variations that you can look, but yeah, so I just think it definitely probably needs to be.
Great, thank you. David?
Two quick things. One, again, bail is a constitutional issue as well, and people are entitled to cash bail under our current constitutional scheme, so it would have to be changed to a much higher level. Two, that I don't want to be too repetitive of what Raylene said, but she kind of nailed it. My concern was you would have to look at a historical data for bail, because I'm sure Wendy can confirm this, but our jail population is very different than it was 3.5 years ago. I don't believe that any of the municipalities are able to book or hold people at this point, which is very different than it was pre-COVID. And I think you'd have a very skewed result if you were to look at the current charges and bail amounts that people have right now in the jail.
Thank you. Heather?
I guess in response to that, I think even those factors that you and Raylene are listing as why it's complicated, even that would be a great starting point for understanding, because right now I think it's pretty opaque for those of us who aren't working in the system. And if there's a lot of complicated factors, it's good to just understand that. And there likely still is opportunity for improvement and for us to do better.
So what do you, yeah, David, did you have another response?
Yeah, I just want to say, I think we should look at numbers. I'm just saying that we need to look historically. So don't take a 6-month snapshot, take a 5-year snapshot. So you can compare what you had pre-COVID and pre-booking restrictions to what we have now and the reasons behind it.
Thank you. Thanks for that clarification. You know, I'm recalling that during the SAC meetings, this conversation got very complex, and I am curious, what seems, could somebody make an offer in terms of where do we start? Is there a group or a body or a person who could help sort of move this inquiry forward so we would have something for our plan? Or know of somebody who knows of somebody? Yeah, Wendy and then Raylene.
I can't promise, but let me talk to Rick, the IT guy, because it would be a matter of setting some parameters. Now, I have to admit, I stepped out of the room for a minute. So am I hearing that folks are looking not only say for 2022, but they also want to go back pre-COVID?
Yep.
Okay, that one might be a little bit more difficult, but I'm not sure. Caleb may actually have a better sense of it, but we may be able to put something together. I just don't want to promise.
Thank you. Caleb, do you have a thought on that?
Yeah, so I just want to caution that the records that the jail keeps on bail are very specific. We keep records on bail that is most recent. So we will not have historic trends or changes in bail throughout incarceration. So it is not a one size fits all. Let's answer the question with information in the jail system. So if somebody comes in on a certain amount of bail, it's reviewed by a judicial officer, it might change, and then it might change again throughout an incarceration, potentially many times. And so we're only going to have the most or the last bail amount. We do not keep historical records of changes. Just something to keep in mind.
So let's just, well, I'm sorry, Raylene, go ahead. But I think that, conducting a review of bail amounts was just one idea. There might be other things that we could do to move this recommendation forward. So let's all be thinking of that as well. Raylene?
I just think maybe that this would be a topic that we could bring up in a future legal and justice meeting. Look at the data and utilize what Wendy and Caleb can bring up. Also look at, are you looking at felonies versus misdemeanors? And then just try to come up with some answers. But I think it would be probably April or May before we could review that, unless anybody else has any other thoughts.
Yeah, go ahead, Tyler.
Well, I was just going to kind of recognize and support Raylene's idea there. And that the idea of the implementation plan is to kind of lay out 1 to 3 year steps to look at these things. And so maybe there is some guidance to review it. Secondly, our Incarceration Prevention Reduction Task Force and the VERA report, and for many years, we've been analyzing and discussing the bail conversation. And so it may be also helpful to look back from 2017, from 2015 till today on some of the work that the task force has already done to see if it helps kind of define some of the information and define our current community's perspective on bail. And then lastly, I would say, I think it's just to recognize how our community uses bail. It kind of like we need to Heather's point, be open and transparent about our criminal justice system's decision on bail. So what charges get bail and what are the safety concerns surrounding it, so that we can have a document that can kind of provide that policy perspective. And I say this with all recognition that it's a judicial decision, right? And I'm not on that side of the house, but I think that that framework document might be super helpful for the community. so that there's an understanding, and I'm not sure we can do that because of the complications, because it is so complex. But I just wanted to recognize and kind of acknowledge that maybe that would be a really helpful starting point.
Thank you. Well spoken. Okay, so it sounds like we've got, possibly if the IPRTF can help move this thing forward, and then it might be a conversation that continues beyond this. It's part of the implementation plan is to keep this conversation going because it's complex and important. Okay, let's do the next chunk. All right, Marty, you want to set us up?
Yes. So the next chunk is about data, and this conversation was interesting because it kind of moved yet another piece into this data category here, this data chunk. So we had two needs that related to data. One was A6, build a data system, and one is A7, create a data dashboard. And then if you look across the recommendations, there are quite a few in the systems section alone that talk about data. And I pulled together those on the white side of the slide here. I think that I'll just kind of run through them real quick here. So A2 is reducing time in jail pre-trial and measuring that. And then I just want to interrupt myself to say that the index committee has been looking at a lot of this data. And so I think we do have some work on these already. But moving on, analyzing the efficacy of the pretrial risk assessment tool. The pretrial work group, I think, also is doing some work on this. And then there's A4, which has 3 recommendations that are related to collecting data, and it's analysis about racial disparities and disproportionate incarceration of BIPOC individuals that we're looking for here. So those are the types of data we need. And the questions on the next slide are: what actions can we take to continue making progress on identifying and creating data for tracking? Barry, do you want to comment?
Yeah, I'll kind of kick us off here. One of the discussions that have been taken place recently is the creation of a data center or data person to be specific to criminal justice and how they can look across all the different silos we have right now and be able to get data throughout the whole system. So that's one thing that I know Executive Sadhu and I and Prosecutor Ritchie have talked about, the potential of having a data systems analyst to be able to deal with just these criminal justice systems and efforts that we're doing. So that's one thing that's a possible solution is actually having someone work on all this. And I know Caleb's been in conversation about that same very thing. He and I had talked about it last summer. So I just wanted to kind of offer up that as that's an idea that's percolating.
Great, thank you, Barry. That definitely would help move things forward. Yeah, Caleb and David and Raylene, go ahead.
So to kind of spring off of what Councilmember Buchanan is talking about, I think that there are kind of 3 components necessary for this particular area of focus. Number 1 is we've got to have a place, a repository, a big bucket that you can fill with information. Number 2 is you have to have a tool that you can use to get the information out and analyze it and display it in a meaningful manner. And number 3, you have to have a person or people who can look at the information and get that information out of the systems in a meaningful way so that you can understand what it is we're looking at. There is a danger in data of making assumptions based on information that is incomplete. And I could get very specific about all of these pitfalls, but just one example, because it happens to be on the screen that we're displaying, is how do we define pretrial, right? So especially when people have multiple jurisdictions or multiple cases at the same time, do we define pretrial as any case pretrial, every case pretrial? And so that's a question that needs answering, and it really depends on moment in time analysis for cases that our current system is not capable of doing. So that's my pitch. I've got a lot of thoughts about data because, you know, being part of Index has been sort of my usage for the last couple of years, but I'm available for questions obviously as well, but that's my thing. 3 things needed.
That was really helpful. Thank you. All right, David?
This is just a comment on a piece of data that would be very helpful in our process from the court's perspective. You know, we did make rule changes last year in order to try to facilitate quicker resolution times and accountability on continuances. And it would be very helpful to look at. I think that rule change went into effect September 1. I don't know if we look at a 1 year, you know, from September on or 6 months, but I would like to know if those rule changes are having any effect. Having attorneys need to call cases on the calendar once they get a certain age, having more meaningful omnibus hearings. It would be very, very helpful from the court's perspective because we have new rules coming up that we need to put into effect by July, whether we make further changes to those, whether our last effort was actually effective or not.
Do you know where to get that data to figure that out?
I do not as of yet. I think we've got Dave Reynolds on. I'm not sure if that's something that we are able to pull from Superior Court.
It's possible.
Okay. So Dave, yeah, why don't you, let us know if that sounds like a great piece of data to have. And I think that it sounds like we've got the index committee and we've got Caleb there. We've got Barry moving forward with a conversation with Satpal about a possible data systems analyst. Those are all, you know, good strong steps. Raylene, you're up.
So to piggyback off both Caleb and Judge Freeman's comments, there for under district and municipal courts, there is a BIP program, SharePoint program that you can pull data off, and I can easily go in and see what the case resolution time is for all of the courts in the state, all of the courts in the county. But as Caleb mentioned, there is a danger to that because there's so many nuances when you pull this type of data. For example, you want to look at use of continuances in case resolution time. Well, if you have somebody that's been out on warrant status for 3 years and comes back, the court didn't hold up that case resolution time. The defendant left the state or left the area and was out on warrants for so long that it's going to skew your results on your case resolution time. On continuances, there are attorneys that use continuances to get defendants into treatment prior to getting a resolution because it would be better for their clients sometimes to get that treatment. And if the treatment isn't always available, then there's more continuances to get that treatment done before it's continued. You also have individuals on stipulated orders of continuance, which means a defendant might get a dismissal as long as they do X, Y, and Z. So they'll have a 2-year program in order to do all of these things to get that dismissal. That means that continuance and that case resolution might take longer than what you would think should be allowed. So you've got to tie in mental health if you're trying to restore somebody, how long that case resolution is. So there's so many different factors to pull that data out. When you're going to review that information, you have to take all of those points into consideration, or you're just gonna think the court's going too slow, the attorneys are going too slow, we're not getting the treatment done. You can't just base it on the numbers.
Is the reason for continuance included in the data set? So you could pull the length of time or number of continuances and length of time and then why?
Not necessarily. I mean, everybody puts the information in differently. I can put in like a mental health evaluation was ordered into a certain screen, and then I can pull all of that data. But what I found recently is a lot of that information isn't put in. A lot of it's not uniform. Even if I was to go and look at the law enforcement database that a lot of the departments are using, some of them check one box, some of them don't check a box. You've got court staff that don't always put it in that screen. So to pull all of that data and get it accurate, going backwards, it's going to be skewed, and you're not going to be able to see why all of these continuances are there. Some of them you would, but I don't think you're going to get an accurate representation.
Thank you. Heather?
So what's interesting to me in this moment and this opportunity is that my observation is that we are really working to move this very complex system into a shared vision, and all moving, rowing the boat in the same direction. And it's such a complicated system. I know that, and a lot of siloed parts working together. And for many, many years, I have heard that there are so many barriers to understanding the data and to getting the data and to the systems talking to each other. And we have 1990 systems that don't do what we want. And I think there's a difference too between a mountain of data versus making meaning out of the data. And I think, Raylene, that's kind of the point you're making, is what's the meaning and significance? And I just want to offer that I do think if you just Google criminal justice dashboard, there are some great examples that show up. And Oregon has one. There's a whole bunch of places that have just highlights of what's happening with the jail or the criminal justice system. And I do think that maybe talking to those jurisdictions, if that hasn't happened already, about how did they develop that and get there. I see Caleb, you probably have some updates on that. And it could be a great opportunity to bring in some serious technical expertise to help build the right system for this. And I do think that it would be helpful for the community to build that understanding of the outcomes of our system and to improve our overall accountability back to those tax dollars. And I think it's worth the investment when my understanding is half of the county budget goes to this system. So it is very much worth understanding the outcomes of the system. And that's kind of the motivation, I think, behind me personally wanting to know the data. And also, we don't know as a community what we need to build, what programs we need to have or expand, what disparities exist, what trainings we might need for different people in the system. We know that anecdotally, we feel that, we know that in our silos, but to see that broad data would actually help us understand what are those collective investments we need to be making to improve as a whole.
Thank you, Heather. That was really beautifully articulated. Yeah, Caleb?
Thank you. So yeah, Heather, just so you know, based on the previously submitted examples that you gave in previous meetings, we have come a very long way behind the scenes with our IT staff to come up with a dashboard for similar purpose. It is not ready for public consumption just yet, but we're getting a lot closer. And I meet with IT on it once a week. The challenge again, and this sounds more like excuses or barriers, but the fact is that it's only based on jail data. And there's much more information in our criminal justice landscape than what is existing in our jail system. Just as an example, the discussion on bail, it's incomplete. And I want to get information from many of our partners to compile data so that it's a little bit more meaningful. And again, we don't have as many of those pitfalls in the system when you're trying to analyze it. So help is on the way. We're getting there. It's just not here yet.
Great, thank you, Caleb. Yeah, Stephen?
Like Heather, I've heard a lot of the explanations for how complicated and why the data system is over the years. But it strikes, and I'm encouraged by what Caleb just reported. I'm encouraged by Barry's report on work with the executive branch on a data analyst or a system like that, and some other of these steps. But it seems to me one of the identifying characteristics for how hard this has been, and therefore I'd suggest it be a feature of a lot of the efforts that we do in A6, build a data system, is establish and require some uniformity of data. It shouldn't matter on whether some people fill in some data or not, or some people interpret one piece of data to mean X and others Y. We should be able to have cross-system relative uniformity in the data so that we can use it in policymaking, in public accountability, and in our own internal analysis. And so I just like to encourage in those places we've identified where there is some forward progress being considered, that be a feature of what we're looking for, and it also be a feature of our implementation planning.
Thank you. Thank you, Stephen. Yeah, Satpal.
Hi, good afternoon, everybody. Sorry, I'm a little bit late. It's still morning. Okay, so I just wanted to weigh in what Barry and everybody has said on it. It is very, very, very critical that we should have that data available, not only to public, but for our own internal management of judiciary, prosecutor's office, public defender's office, and then we are transparency that it is available to public. And I just wanted to say that I am preparing a proposal. I want to take it to the council soon to ask for something of that sort. The second thing is I agree with Stephen or Caleb. We do have data. It's just not in right. They don't talk to each other. They don't write format, or there are some missing pieces or check boxes which are not available. It really, we are not in the ancient times that we don't have data or we don't collect data. We do. And our intermediate attempt is, until we are able to get a coherent system which can talk to each other, is interfere with that manually. That's what this proposal was, that hire a data analyst. First, we need a data mining person who is expert at going into a system and pull the relevant data and put it in a spreadsheet, for lack of my knowledge of IT. And then that person may not be the right person for data analysis. Interpretation of data, what does this mean? Just having a data in a spreadsheet does not give us that insight what we are looking for as public or as government officials and judiciary. So we are trying to tackle this with a proposal to have 1, 2, 3 people to start this thing. But we are not going to stop. We have made investments in prosecutor attorney's office. We have made investments in public defender's office to automate that thing. And we will be making more investments into the jail system, where many things originate. So, so rest assured to all the members that this is the important thing, and we are paying attention to this. Thank you.
Thank you, Satpal. That's really exciting. Yeah, Barry.
So Satpal's vision and mine are identical in the thought that we need to have a data team of some sort, a data group. And you can give that to Mr. Sadhu and myself as the action items, Holly. It's probably on your next slide. So we will definitely pursue that piece of this for sure.
Great. And I just want to flag, there's that other element too that that Caleb mentioned. It's the, it's the collecting of the data, it's the analyzing the data, and then it's the sharing, right? It's the ability to articulate it in ways that it can be shared. So we definitely want all three. And boy, I really appreciate the work that's already been done in this area. I appreciate the barriers to having workable, being able to work with data and knowing what you're looking at. I want to also just acknowledge Marty's work in noticing where we're getting these kind of cross areas and sort of plucking from the different recommendations. So we're starting to see where some priorities are that live in other parts of the needs assessment. So thank you, Marty, for doing that. And Janelle, I see your hands up. Your turn.
Yes, since I have to leave in a few minutes, I also want to add in terms of the data.
Yeah.
I think we should try to utilize WW and look at some different departments that we have within the university, because oftentimes their research departments, whether it's the psych department or other departments, they do have different grants, and perhaps maybe we could have some academics on board to help us with this as well.
Great suggestion. Thank you. Okay, anything else on this one? Yeah, go ahead, Tyler.
Yeah, just the last piece I was going to add is it's another example where I think the index team has done a lot of identification of data needs and data gaps. So, I think for Holly and Marty and for this spreadsheet, I think just going back to index to identify some of the work that's already been done. So we can start at that basis instead of recreating the wheel.
Yeah. Yeah, a lot of the, you'd mentioned this earlier, and it made me think that there's, the work that has already been done by the IPRTF and its committees has really got a lot of concrete stuff that we might be able to build right into this implementation plan.
And then the last piece, Holly, would just, I'm sure this group understands, but it's not just a county item, right? The data collection for the criminal justice system. So ensuring that municipalities and understand the needs for consistent data is very important as well.
And are there folks working at the state level, Tyler, that you know of also with that you might be able to share resources or methodologies?
I don't know that specifically, but I can recognize that, AOC does a lot of the data collection systems for Superior Court and for other lower jurisdictional courts that somebody else on the call probably has more background to.
What's AOC?
Oh, sorry, Administrative Office of the Courts through the state.
Great.
That's who's working to upgrade Superior Court's data system and the district court and the lower jurisdictional courts in the next couple of years. So I do want to recognize that timing does seem right for all of the county and local jurisdiction investments into data collection systems, that if we identify a really good solid list of data needs, we probably are in a right time in our community to make sure the data systems are collecting that information.
Yeah, thank you. Caleb?
I did a national search for larger companies or organizations that were doing criminal justice data gathering and mining. And the ones that I found were larger scale operations that really focused on statewide initiatives and or say Department of Corrections level focus. So they weren't really interested in a small project like our local community. It was technically a small project for them. But we do have a partner with the Administrative Office of the Courts who does specific data mining and collection. And so we work with him, actually, in my office, I'm working with him routinely to try and provide him information about what's going on in our jail specifically and how it relates to the projects that Tyler mentioned about the courts and the processes that they're looking to get up and running for their upgrades, because they're working, AOC is looking to get additional upgrades for systems for all courts of limited jurisdiction throughout the state as well.
Great, thanks. I just saw some cameras pop. Louise, did you want to chime in? Did you have any thoughts on this?
I will say that, like, on the data front, we're currently implementing a new case management system. So help is definitely on the horizon in that sense. We expect to go live in August of this year. So I would say probably 4 to 6 months following implementation, we'll have reasonable data that we can really start relying upon. But unfortunately, as things currently sit, it's a little sketchy. But we're working towards a solution, and I think that's going to be a tremendous help. And actually, the program that we're going with has a tremendous data dashboard that's public facing. It's currently being used by King County Prosecuting Attorney's Office. So for those that are interested, take a look at that. I think we're probably several years away from that level of integration, because it takes multiple platforms of software to accomplish that particular view. But it's doable. And I think if we had a data analyst on staff and assisting us with that process, I think we could really make some great steps. So the support is greatly appreciated.
That's great. And Louise, if you haven't already, make sure you put that in the worksheet. Yeah, those just references, because I think as we get going, that'll be really good to have on hand. Okay, thank you. Raylene, did you have one more comment you wanted to make?
No, I think everything's been touched on. Darlene Peterson might have a little more information on the onboarding of the Odyssey system that is being worked on for through the Administration Office of the Courts for district and municipal courts. It'll be similar to what superior courts are using in the state, except Tyler Industries is trying to make it adapt to what the courts actually need, because the volume for district courts and municipal courts is a lot higher than superior courts. So the onboarding of that system is taking a little bit longer than what we originally had planned.
This just seems like somebody used the term of this as a really ripe opportunity. And I'm really struck by that. It seems like we could really use those worksheets to good advantage right now. Like, if people were able to write in, here's what I have, here's what I need, here's what I know about that doesn't work. I think that if we can really, that will help move things forward, especially as Paul and Barry get that staffing for us. We could really move something forward. Bill?
Yeah, and I'm sorry, I just got out of the other meeting, so I'm just rejoining here in the last 3 minutes.
Glad you're here now.
Yeah, just wanted to ask, is there, when Peter Frazier's proposal of the jail be adequately sized to avoid booking restrictions that was incorporated into the SAC recommendations. Is there any thought on assessing and collecting data on the number of people who would be booked into jail if there was space available and we weren't in booking restrictions, so we can get an assessment as to what the true needs of the jail are? And that would probably include just surveying law enforcement agencies for a month would be one way to assess that. Speaking with the judges. So I don't know if that's something that's been ferreted out. Like I say, I wasn't here for the last hour and 15 minutes or so.
Anyone have a response to that? Yeah. Thanks, Brian. Go ahead.
So it's a good question, Sheriff. I asked Bellingham Police to capture that data. I'd have to go back. Unfortunately, it is somewhat incomplete. Because it really just depends on what officers are able to capture, no pun intended, at that time of when they engage with someone. But let me ask again to see what they have. I know what was shared with me previously. I believe Ferndale had, I don't know if anyone here is from Ferndale Police, but I believe they had kept pretty good records as well. So I'm happy to look into it from the Bellingham Police side, and we'll share.
We did a survey, and this is going back, I think, before they built the temporary jail, so it's an oldie. But I think we did a survey of, and the booking restrictions were nowhere near as tight as we are now. And it was something like close to 800 people a month that were not booked, that the officers would have booked, and even maximizing their reasonable discretion on issuing criminal citations or referring cases to the prosecutor's office. So, and another thing, as I say, I would look at what the judge, assess the impact from the judges as well.
Great.
From all, and again, I've emphasized from the beginning that this can't just be a county look. I know when the Vera came here, I strongly suggested they look at all the agents, all the court systems in Whatcom County, all the prosecutors' offices, all the various law enforcement agencies and courts for collecting data, and I think that was not accomplished. So if we're going to get something, if we're going to collect data, we might as well get the complete data. So thank you very much.
Thank you. Great, Caleb.
Sorry, I know I'm talking a lot. In response to what the sheriff asked, I began an effort early 2022 to get information from the other jurisdictions in Whatcom County. So Ferndale was one of those stops, and Ferndale had, like Brian said, pretty good information about the number of encounters that they had with people that they would normally have booked on, but they were not able to. How they quantify that was they had a warrant for arrest, but they were not ultimately arrested for that. And then they also had people who were cited in the field and not brought into custody. And so they had two different ways for tracking that. I'm not sure about the other agencies because I didn't get very far down that path of travel, but that certainly could be done. Like the sheriff said, even if it was a moment in time study of a month or two or a quarter or something like that, it would certainly be instructive for the number of people who would otherwise be incarcerated if it were not for the booking restrictions.
I see the link too that you're making with that other with the other recommendations. So let's put a pin in that one and just think about the timing of that and what would be feasible and who would do it. Gang, it's just 7 minutes to the hour, so I think we're going to need to wrap this up. And go back one, please. I think you just skipped by one. Yeah, so the actions, we've been doing a great job throughout this whole meeting about taking, kind of people identifying what we need. And this is in general to the data, which we've discussed about. But it just in general, we've gotten, folks have really done a great job of leaning into what I can do. And I again want to encourage you sooner rather than later. I want to remind you how fast this process is going. So just anything you can use to populate that worksheet is going to be really helpful to our work together, and just how we're starting to build this kind of body of understanding. Also, that if you had thoughts, I want to tell you, this really is true of the SAC. If you have thoughts after this meeting, you're like, aha, or I didn't say it because I just didn't get it on the table. It really helps if you email us, because Marty and I and Kathy, we're really tracking this process very closely. So it helps us figure out what to do next. So if you have, leftover thoughts, go ahead and email them back to Kathy and she'll route them appropriately. Okay, so that's I'm just so glad that you're all here. I'm so impressed with people's depth of knowledge. Marty, is there anything else you'd like to say before we have Barry wrap us up?
I just want to reiterate what Holly said about using the worksheets and that we're moving on to services next. So, the worksheet's very long. There are 32 recommendations. Each one has its area on the worksheet. If you can at least go through systems and services, that's great. If you can continue on through facilities, even better, and just keep adding as you think of things. Thanks.
Okay, next workshop, Friday, March 17th, 9 o'clock to 11:30. Note the time change. We had to do a little shifting for this one. So it's gonna come early. And thank you, everybody, for just for all your great participation. And Tyler, or not Tyler, I'm glad you're here. Barry, do you want to wrap us up here?
Yeah, thanks, Holly. Well, I thank you all for being here today. I think you could see how this process works. I think it's just a great, group discussion, and Holly just leads us through this, so effectively. And Marty's taking notes. I mean, this is just going to be awesome. Thank you all again for being here today. Look forward to those of you who will be here next week and beyond. With that, we are adjourned. Go have lunch. I know you spent a long morning. Thank you so much again. Bye.